traditional medicine. And when I talk about traditional medicine, I'm talking about hospitals, pharmaceutical companies, anybody in medicine, anybody who makes their money in medicine, who gets reimbursed from insurance companies. They don't make money off of two types of people.
Okay.
Healthy people and dead people. They make money off of chronically sick people. It's like a built-in incentive structure, but it would be nice if you had a healthcare system where doctors were incentivized to keep you healthy. They don't have a platform for telling people about all these health hacks that keep people healthy. And I thought it would be fascinating to tell everybody about that and really spotlight the people that are making this happen, staying vital, staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This show comes out every Tuesday. Always looking for the latest, greatest health hacks. We've already covered an enormous amount of information. This is a really exciting show, and so what we ask you to do, if you're listening to this on just the audio, subscribe to it at iTunes. Just hit that subscribe button. And hello and welcome to Health Hacks with Mark L. White. I'm Rusty Humphreys. Today is a very, very important special show. I know you've been waiting for this guest for quite a while, Mark. And who is he and why is he so exciting for you?
Well, first of all, I'm so honored to have Dr. Kahn on our show. He's known as America's healthy heart doc. He's actually written books on the subject. One book really exciting called Dead Executives Don't Get Bonuses, which I think a lot of our listeners will really appeal to them because we want to get our bonuses and we want to live a long time. And I actually have the privilege of meeting Dr. Kahn for the first time a few weeks ago, or just getting together a few weeks ago. And you've really opened my eyes to like people my age. I'm going to be 50 this year. And, we don't realize the toll stress takes on us. So I'm so happy to have you on the show.
Well, thank you. You're looking good for almost 50. And you're right. Your message that you brought up, the message I like to teach is a critical and crucial message. It's not always an upbeat message, but it's a real conversation. We can still have some fun with it. It always ties into sexual function. Everything about health has to end up, does it make you better or worse in the sack? So we'll bring that in at least at the end. But absolutely.
Yeah. But let me ask you this, like, how did you come to be the America's healthy heart doc? Like what got you going?
Yeah, I didn't pick that title. I don't mind it, of course. It was about... I've used nutrition in my cardiology practice. My cardiology practice is 30 years of seeing patients after about 7 or 8 years of training. And I was a big heart attack guy. You had 3 a.m. chest pain. I was there with my stent, my balloon, whatever it required, send you off to bypass. But I actually was always interested in nutrition. So I kind of had this duality. I'll take care of you when you're sick, but I don't want to see you again. I want to teach you how to heal this problem on its own. And then to answer your question directly, about 8-9 years ago, I found a program where, like some people go back on weekends and get an MBA. I took my weekends and enrolled actually at University of Southern Florida in Tampa. Mm-hmm. I did a year-long integrative cardiology, healthy cardiology, very advanced program. I loved it, met people all over the world. I was the first one to really graduate with that whole degree from University of Southern Florida. And I kind of dinked around with standard practice for a couple of years. But the bottom line is about 5 years ago, I gave up a big group in hospital and cath lab to say, I really want to teach prevention. And Reader's Digest offered me a couple of years of writing for the magazine and publishing my first book called Your Whole Heart Solution. And that was the title I wrote for Reader's Digest magazine under America's Healthy Heart Doc. So it kind of stuck. And frankly, there's not a lot of competition. I have some really great peers, but all of us could fit in a red telephone booth in London across the entire United States. It's all drugs and surgery, which have an absolutely appropriate role some of the time. But it should be the goal to get people off or avoid needing those throughout their entire life.
Do you think people in general, like especially when we hit our 50s and 60s, do you think we don't put enough mindfulness to our heart and until we have that oh crap moment and we're actually having chest pains in the middle of the night?
Yeah. There's no question about it. And the education piece isn't scary. It's just real talk that, there is still the number one cause of death in the United States is in women and men. Heart disease could be sudden heart attack, could be postoperative after a bypass, could be a stroke. Those disease processes are present for decades before the big day comes. But it's not built into the medical system. I find this the most frustrating thing. Get a mammogram, get a thermogram for women, great. Get a colonoscopy at age 50, great. What do you do at your doctor's age 45 or 50? You have a couple routine blood tests. You're not allowed to order an electrocardiogram. You're not going to get a stress test paid for because it's not a very good test. So actually nothing's done, and the system is built to wait to the day I got to be in the emergency room, waiting to rush you, 911 to the cath lab. When if we started this process 6 months, 1 year, 5 year, 10 years, even earlier, both the education on how to prevent the disease, but we have the ability now to really give you real numbers. You're 49 years old. Your arteries are actually like a 72-year-old. Well, that might shock you, but gives you time to work on it. You're 49-year-old and your arteries are just like a 49-year-old or a 44-year-old. That we can do that so precisely and so simply. And that's what I lecture anywhere and everywhere around the country on the early detection of heart disease. Keep a executive board together and not have it maimed by illness or early death. And there's plenty of examples of that. And you don't have to be a C-suite guy necessarily to take the message, and you don't have to be a guy to take this message. It applies absolutely to females too.
How do you know somebody's artery age? Like, how would anybody know their artery age?
Yeah, there's a couple different ways to judge if you're aging gracefully or not in general. Some of it is actually, there is facial recognition software from Israel that's said to be as accurate as any genetic test you get. I mean, losing hair, turning gray, being wrinkled. There's an unusual earlobe crease called a diagonal earlobe crease. I would suggest your listeners just go on the internet, put in diagonal earlobe crease, DELC. It's a 50-year-old physical exam finding that in the last 5 to 10 years has come back as a discussion point. It's about 70% accurate if you have this unusual crease. Or just look up Steven Spielberg, because all the pictures of him show this very deep cleft in his earlobe. And I don't know if he is aware of the connection or not, but his picture is easy to find. These are, erectile dysfunction. There you go, guys, 40% age 40, 50% age 50, 60% age 60 have erectile dysfunction. It can be the first sign of clogged heart arteries because it just shows up quicker below the waist than it shows up above the waist. All those are important clues, but the real winner is you can go to your local hospital, whether it's Aventura, Holy Cross in the Lauderdale area, whether it's my local hospitals in Detroit, and you can get something called a heart artery calcium CT scan, heart artery calcium CT scan. It is a test that takes 10 seconds. There's no needle, there's no injection, there's no IV, no exercise. It exposes you, man or woman, to the same amount of radiation as a mammogram, but you probably have this test once in your life or maybe a second time 10 years later. So it's a very low exposure, lifelong. You actually see the heart arteries directly. You see if the heart arteries are calcified, hardened, diseased. What you want is a report that comes back a calcium score of 0 or something very low, not a calcium score that says you are in the 99th percentile, a real outlier with unknown and unexpected disease burden. Unfortunately, this disease process where you take nice clean arteries like this and they become significantly clogged up is a completely asymptomatic disease for years and years and years, maybe with the exception of erectile dysfunction, really. It's an asymptomatic disease. So, the key is pick it up early or find that you don't have any, which would be ideal, and start working at age 41 or 44 or 35 or 47, start working on it with everything we know about it. So you don't end up that victim in the emergency room. So the test tells you your true artery age. It's recognized by several thousand research studies. Just this weekend in Europe, in Paris, another medical society, the European Atherosclerosis Society, highly endorsed, get this test. You don't need to be on Lipitor if you're a 0 most of the time. You might need to be on intensive therapy, which could include Lipitor, if you find out, damn, I'm aging and it's not graceful inside. So the second step after you get the CT scan is get advanced labs. The CT scan costs about $100. If they charge you more than that, just call the next hospital. Mm-hmm. You're going to pay out of pocket. Don't involve your insurance. And have it once. And it's easy. It's not claustrophobic. Nothing but the simplest of tests.
I actually had that test done on your recommendation just last week. I think my test came back at 43. So right. Not a 0. How old are my arteries at 40 when it says 43?
Yeah, we can punch them through. I mean, at age 49, it's a little bit more than average. So, I could do it on my phone. You're probably like a 55-year-old man from an artery standpoint. Now, we'll get together and talk at some point. And you did the next step, get a few advanced labs, try and figure out why. I mean, if you're a smoker, it's obvious. If you're struggling with type 2 diabetes, it's obvious. If you know your cholesterol is 394, it may be obvious. But there's a few other nuances that show up in the labs that you should know about, and then make a plan. Watch Forks Over Knives, a great documentary on cable. Read a book. I've got a book called Plant-Based Solution. It's all about heart disease reversal, or other books that are out there. It doesn't have to be mine, but make some changes at age 49 so that this process starts to slow down. And it's the whole thing. Try and get sleep. Try and get fitness. Mm-hmm. Try and manage your weight. Try and have social connections. We're all born to be workaholics. If you're listening to this podcast, you're probably a workaholic by definition.
So I actually read your latest article. I think it was a Medium, about 12 reasons why we should get rid of meat. Is meat the number one biggest contributor to arteries becoming calcified?
Well, so probably diet. You could say diet, fitness, sleep, smoking. You can't change your family history. There are some importance there. So probably diet is number one, although I often tell patients sleep is number one, because if you're sleeping poorly, you're going to skip the gym. You're going to grab the bagel and the donut, not the apple and the pear. If you're chronically an insomniac, that does age your arteries. It's been shown to correlate with higher calcium scores, the test you had. So sleep is critical, but right after that is nutrition is fundamental. And we know that half the world's population never develops heart attacks, strokes, and calcified arteries. Half the world's population. They're living in rural, untouched regions of the world. There's fewer and fewer of those, of course, but they do exist. The single pocket where there is essentially no calcification of heart arteries is some tribe in Bolivia that lives in the jungles. They actually loaded them all in wood boats, took them to a hospital down the Amazon, tested them, and there's like virtually no heart disease at age 80 in that group. So it can exist. It's not our nature to always have aging arteries. It might be our American cultural nature, and we might have some extra factors like our lifestyle and our genetics. But nonetheless, nutrition is number one. And probably before I would throw meat out as the number one, I would throw processed food. We're running around and we're driving through a drive-in, and we're grabbing a burger, fries, and a malt because the kids want it, and there's a soccer game, or the wife's out of town, or the husband's away, and that is the single worst food group: the processed, junk, fast, sugar-sweetened, poor quality food that you can see. And the medical system doesn't get that. I work in 2 hospitals. One has a Wendy's in the lobby of the hospital. First thing you see when you walk in, University Hospital, is Wendy's burgers, bacon. Second hospital has a Wahlburgers, because Mark Wahlberg has a good chest. These are the messages that the medical system are giving to thousands of people a day that are visiting the 2 hospitals I'm on staff at. So you can't really go to a hospital or your doctor always and get reliable advice. So after you get rid of the processed junk, which means you actually have to learn how to cook, or you have to, in a restaurant, that means basically eating the side dishes like the broccoli and the baked potato and the salads, because everything they're making in the middle. After you get rid of that, you do want to shift your ratio, way more plants, less animals. And the 12 reasons I put in that article are just amazing science, biochemistry reasons. They don't even include the environment, the global warming, the ice cap melting, the hottest July in the world history, just one that passed 2 months ago. So there's other reasons, but I just approached, we actually have learned more about the science of what a high meat diet can do to your physiology, and it generally a factor in clogging your arteries, absolutely.
What do you think about the paleo diet versus, say, cutting out all meats?
Yeah, so the paleo diet on paper, and in fact, I have a copy 5 feet to my right, the first book that really caught on, called The Paleo Diet by Dr. Loren Lauren Cordain. If you read the book, it's actually quite reasonable. I've written an article about why I thought this was a reasonable book. I mean, he hated saturated fat. Beware egg yolk. Beware excessive fatty meats. We all agree, added sugar in the diet, sweets and candies and soda are evil. That was easy. Add a lot of greens, add a lot of berries to your diet. He was an advocate of trying to find bison and venison and really natural wild meats, which are known to be much, much lower if you can find them in saturated fat and cholesterol content. They're just hard to find. He later changed his tune. So the original proposal was so much better than the Wendy's, the Hardee's, the Carl Jr., the McDonald's and Burger King diet that, it can be applauded for a step forward. But when you get right down to it, the real advocates, we really aren't certain. I think it's fair to say what actually was the diet of our ancestors 20, 30 years ago. Were there some grains? Were there not? There's evidence that there clearly was, at least from some pockets of the world. Many of the paleo advocates have now added back a little dairy, some beans and peas. They're still pretty tough on the no whole grains rule, which 98% of the science says 100% whole grains like brown rice and whole wheat. And quinoa and buckwheat are actually some of the most fundamental health foods out there. I think the paleo diet excitement is fading. Just in the past 4 weeks, a scientific study looking at a blood marker called TMAO, but it was a healthy diet in Australia versus the paleo diet in Australia, a true randomized science human study. And the paleo diet produced this biomarker in the blood that there's a lot of data is bad for your arteries. So I would tell anybody, go paleo if you're getting off of McDonald's. But, make sure that paleo diet is really like the original Lauren Cordain. Lots of leafy greens, lots of berries. But don't stop there. I probably would keep transitioning to a largely whole food, plant-based diet. Your readers, your listeners would know. As just an example, I haven't had dairy, eggs, or any kind of meat for 42 years. Age 18, I kind of had a University of Michigan dormitory epiphany. The food was horrible, and I started eating at the salad bar and felt fine.
I don't think cows existed back in prehistoric times. I think that's like basically something that's been created by humans and full of antibiotics.
You could argue if somebody's listening and they're a hunter and they're really taking game that's truly wild and untouched and isn't hormone and antibiotic raised, I mean, the quality of the meat, even the quality of kangaroo in Australia, but then you get into, the ethics of slaughtering animals, the environment, and you can never feed the whole world just with, a live game. I'm not advocating it, but there is an argument to be made. It's a better choice. It's not when 98% of Americans, if they're eating meat, it comes from those horrible factory farms where the only way to keep the animal alive is antibiotics and hormones and cruelty and infection. Get the animal as fat and as big as fast as possible, then slaughter it. It's unhealthy food. It's the way our food industry has gone.
Well, what do you think about Beyond Beef and the Impossible Burger? Are these healthy alternatives or are they too processed?
Yeah, the only really strong statement you can make, I've read 2 analyses recently, the Beyond Meat Burger, the Impossible Burger, is the stress on the environment is dramatically lower. The amount of water required to produce a burger, the amount of land, the amount of deforestation, it's significant. It's like 70, 80, 90% less. It takes a ton of water to make a pound of beef, and it takes a lot of greenhouse gas and all. There still are other issues, industrial pollution, that aren't addressed by food choice alone, but food choice matters. When you get to health side by side, we really don't have a comparison. I think if you studied blood and blood vessel damage, it'd be pretty close between a Beyond Meat burger and a better quality Piedmontese beef burger. I'd rather you eat the lettuce, the tomato, the side salad, and all. But it's changing. It's opening people's eyes. People that would have said before, I'm never, ever eating a vegan, a vegetarian choice. I mean, now there's, people are flocking to Burger King and Ruby Tuesday and, the 35,000 restaurants that now carry these things. I think it's going to be good in the long run, in that it's going to introduce people that they aren't really addicted to animal products, because the food industry is moving forward. I mean, you're going to see contraction of the meat and dairy industry. It's happening right now. And it's like Uber disruption. It's the nature of business. The food industry is being disrupted by technology. by client preferences. They're preferring these non-meat options.
At the same time, you're arguing that we should stay away from processed foods.
Right.
And what's more processed than Beyond Beef?
Yeah, I think it's, I would suspect the health consequences are similar to a beef burger. The environmental consequences are favorable to the Beyond Meat burger. So if you're going to have a Beyond Meat burger, have a salad, have broccoli, eat an apple, eat a peach. I mean, eat some whole foods that are untainted by factory production.
So a guy like me, his arteries are that of a 55-year-old. What do I do to get back to arteries of a 25-year-old?
Yeah, it's hard to get back. You might be able to stop so you change the rate of progression. Some of it's the very simple messages that are so passé, but they are important. There is a study, for example, from using something called the American Heart Association Life's Simple 7. That's a website anybody can check. Do 7 things and do them well. You will slow the rate that calcium score changes over time. Don't smoke. Get half an hour of fitness in a day. Keep your waistline under 35 inches if you can, or 35 or less, or your body mass index. Eat more fruits, vegetables, whole grains, and legumes than the average person. Doesn't have to be perfect, but eat a lot, just like we talked about. Get your blood pressure, your blood sugar, and your blood cholesterol under control, which means you have to get the tests. And you have to either try lifestyle change for 3-4 months and see how far you can jack it. I have many people drop their cholesterol over 100 milligrams per deciliter just with changing their diet rapidly. And then you would believe that many of them drop their blood sugar back to normal. So, you got to address the simple things. I am an integrative cardiologist. I will put you on a couple vitamins that may alter the way your heart arteries are calcified. Vitamin K2 would be one. An aged garlic pill. These all have some scientific studies in humans behind them, just not commonly used or certainly very safe. There is a therapy called chelation, the idea that you can get a chemical into your blood that can actually take the calcium out of the arteries. It's being studied actually at University of Miami, so it's close to where you are. And their initial study was quite impressive. There's a second study going on now. It's a little too early to say, just start slamming chelating chemicals, but it may not be unreasonable actually if we get a little more data.
How about red yeast rice and fish oil? Are those healthy alternatives?
Well, fish oil is a way to get omega-3. And the bottom line there is there's a simple blood test that will tell you, and you can do it at any hospital, any clinic, Quest, LabCorp. If you're very deficient, and actually the number one nutritional deficiency I see in my clinic is a low omega-3 level. If you're not eating salmon, and I don't eat salmon, so if you're not putting ground flaxseed and hemp seed and chia seeds, or if you're not taking an algae omega-3 or a fish omega-3 supplement, you're probably low in omega-3, and it can impact your artery health, can impact your joint health, your autoimmune health, your brain health. So I check the blood level, but I get some kind of omega-3 into all my patients. I'd rather do it with food, eat walnuts. They're rich in omega-3, whereas peanuts and almonds aren't. But if push comes to shove, I will supplement them with algae or real good quality omega-3 fish. We had all this data for omega-3 fish oil. About 5 years ago, the data kind of swung, not so positive. It's swinging back, but I personalize my approach to patients. So I treat people that are low with omega-3 supplements or intense food choices. The other one you mentioned was red yeast rice. Red yeast rice, if people don't know, is a vitamin you can buy up at your corner vitamin shop that can lower cholesterol in a method similar to Lipitor or Crestor, but it's over the counter. There's a huge study in China. You can actually prevent heart attack and stroke with red yeast rice. So I use a lot of red yeast rice. A lot of my patients don't want to be on a Lipitor, have had a bad experience with Lipitor. There's new guidelines that came out of Paris. I mentioned there was a big meeting that the new goal is to push your LDL cholesterol really, really low. The buzz of the meeting was there's no too low cholesterol level anymore for heart disease prevention. Well, I mean, I'd rather you try and achieve that with lifestyle, with exercise, with change in diet, with fiber, hydration. But red yeast rice would be another way to do it.
Now, stress is something that everybody's talking about now and talking about mindfulness. Is there any correlation with meditation and mindfulness and healthy arteries?
Yeah, there's some pretty powerful data. You actually can lower your cholesterol with meditation, yoga. These are scientific studies. Lower your blood pressure with meditation, yoga for sure. Maybe improve your quality of life. There is a famous study, 2012, that if you've had a heart attack and your doctor refers you to cardiac rehab, the exercise program, the study involved half the people did exercise and were trained in transcendental meditation. Half the people were just trained in cardiac exercise. And the group that got the TM training had 50% lower problems in the next 5 years, which is more powerful than almost any drug we have. So transcendental meditation, mindfulness meditation, breathing practices, they really should be built into cardiac programs before the heart attack or after. It can be as simple as a few minutes of just quiet, or using a phone-based meditation app, in which there's many, many of them. And don't leave out sex. Sex is very mindful. And
yeah, I remember the prescription you gave me was have sex 3 times a night. I took that prescription and gave it to my wife. Well, she wanted a second opinion.
Yeah, well, she probably wants you to get a second wife. There actually is some data from Wales that if you've had heart disease and you have sex 8 times a month with your partner, compared to men who say, I don't, there's a 50% reduction. That's even a little more powerful than the meditation data. There's some other bizarre data if you want to avoid prostate cancer. 8 times a month is amateurish. You got to shoot for about 20 times a month for prostate cancer prevention. So, we guys need to make a t-shirt that says, for medical reasons, my doctor has me on the 8 and 20 program, and see if we can get a little response.
I think we have a new book here, the 8 and 20 plan.
We got it.
So why isn't regular cardiologists embracing this? Why do you think, what's going on with the system where 99% of the cardiologists wait until you're calling them at 3 a.m. with chest pains?
Well, number one, you're not going to see a cardiologist typically until you're in that, stress. Your primary care doctor is busy, whether you have a concierge or a standard one. I mean, they're taught in a standard way, which is just wonderful. I'm not criticizing what your primary care doc is doing or their qualifications. And there is no pretty or handsome drug rep that comes around saying, hey, here's a new scientific data on heart CT scanning, or here's a new data that these few labs may open a bigger window and a bigger picture on your patient's heart health. It simply doesn't exist. So the educational process, it would be very unusual to have grand rounds at a hospital on heart disease prevention. When I go to my hospital's annual weekend heart prevention symposium, a bypass surgeon speaking on the new surgical technique, and the stent guys talking about how we have been able to, replace the aortic valve. That's not prevention. I mean, there may be one talk out of 10 that really gets to lifestyle, fitness, nutrition, and the rest. We got a long way to go. There's not a financial platform to have doctors take a few more minutes to do all this. So the good news is the internet is, a blessing and a curse, but you can find reliable information without necessarily getting it from your doctor.
So an executive hears this, he wants to get in touch with you. What's the best way for them to get in touch with you?
Yeah, well, I encourage that actually, because I know for certain, and I've been involved in saving many, many lives and preventing many illnesses. I'm proud of that. I did a good job with the stent. I do better with sprouts now, as I say. But it's really high tech. It's high-tech approach. My labs are crazy advanced, and it requires of me to kind of stay up to date, which I like that challenge. But I have a website, drjoelkahn.com, drjoelkahn.com. Or honestly, if you Google my name, I've done, 500 YouTubes and 1,000 articles and 6 books. And I've been on every podcast except yours. And now I can check this off on my belt and say hooray. And, again, don't ignore clues. The guys, if it's erectile dysfunction, don't just get Gainswave, which is an awesome procedure, but get Gainswave and get your heart checked kind of all at the same time. Women, it's a little, less reliable to use that sexual evaluation, but, around age 45 or 50, start reading, start digging into it, and ask your primary care doc if they'll order a heart, artery, calcium, CT scan. $100, best $100 you ever spend.
So if the penis isn't working, it might be something going on with the heart, and guys will pay attention to that.
Absolutely. Since I launched Gainswave in my cardiology practice, which was a bold move that caused me some consideration, how's this going to play? But the science was so solid, and I really do care about my patients and want to offer them procedures that work and improve the quality of life. But guys that I was dragging into the office to come back after maybe a visit a couple of years ago, they're running back to the office with penis care. And the good news is I can convert it from a penis visit to a overall wellness visit because they're there and I can grab them for their labs and sit them down. So I'm finding it to be a very effective tool. It's no surprise guys don't take awesome care of their health. I'm not sure women take awesome care, but at least the mammogram thing, the gynecologic thing, they're in a routine, many of them, to see a physician. A guy can easily skip a few years and, things are literally falling off his body before he decides to go get some, opinion. And when the heart disease is such a silent, difficult, but serious condition, really, you owe it to yourself, your family. I say it's like irresponsible for a corporation not to get their executives evaluated in this way from a fiduciary responsibility. I mean, you don't want to lose one of these guys or have one of these guys out, guys and gals, for 2, 3, 4 months because they've had a massive heart attack. Like the, Delta had a new CEO the end of 2015, 6 weeks into the job. He almost died, Oscar Munoz. And he ended up having a heart transplant before he came back to, it's actually not Delta, it was United. Oscar Munoz at United, they lost their CEO for 9 months by something that 6 weeks earlier could have been detected, no problem, and could have avoided that tragic situation, although he's alive and well with a heart transplant.
Well, hopefully we get more word out there and get everybody to realize that this stuff is preventable, it's detectable, and it's reversible.
Wow, that's the PDR I talk about. Prevent heart disease. If you can't prevent it, detect it early. The CT scan's not the only way. It's just the easiest, most accurate way. And it is actually a reversible disease. Maybe not back to 18-year-old arteries we're born with, but you can stop this process and identify that it's no longer building up in your arteries. Absolutely. I do that all the time.
I want to thank you for your time. It was great finally getting you on our show. I know we were hoping the hurricane wouldn't hit because I was excited about this. It didn't come, so we're very happy.
Well, I think there's a high energy plan here that we needed to get together. Thank you.
Thank you, Dr. Kahn.
All right, if you want to find out more about Dr. Joel Kahn, go to his website, drjoelkahn.com, also the Kahn Center for Cardiac Longevity. If you want to find out more about Mark L. White, go to his website, marklwhite.com. And do us a favor, would you please subscribe here at Apple Podcasts or Google Podcasts or YouTube to let your friends know about the latest and greatest health hacks, all here at Health Hacks with Mark L. White.